Every day, every single day, things are happening in the world of deals and deal makers. And there's never enough time to keep up with every company, transaction, announcement, or whatever. It's just exhausting. And we have a new product to help fix that. This is Axios Pro Deals, a new premium subscription product bringing you tailor-made insights like never before. For the last 5 years, Axios has helped deal professionals navigate the whole deal landscape with Pro Rata. With Axios Pro Deals, we're diving deeper into the industries that matter most to you. You just want stories on fintech? There's a newsletter for that. MedTech deals? We've got you covered. The future of retail? We'll guide you. With Axios Pro Deals, you're going to be getting all of this industry-specific insight and expert analysis at a level you simply can't get anywhere else. So if you're a venture capitalist, private equity investor, banker, trader, founder, executive, anyone who cares about deals, Axios Pro is what you need to help you understand what matters and why. Start your free trial today at axiospro.com.
Welcome to our Vitals Checkup, Post-Pandemic Access to Care virtual event. I'm Caitlin Owens, a healthcare reporter at Axios, and I'm coming to you from our office in Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and #Axios events. Over the next 30 minutes, I'll be joined by my colleague, Adriel Bettelheim, and we'll be discussing the path forward for healthcare access in a post-pandemic world. Our first guest today is the Centers for Medicare and Medicaid Services Administrator, Chiquita Brooks-LaSure, joining us from Washington, D.C. Welcome, Administrator.
Thank you so much, Caitlin.
So let's start talking today about one of the biggest elephants in the room today. There's been all this discussion about massive coverage shifts that could be on the horizon post-pandemic, particularly with the Medicaid population and also on some of the ACA exchanges. Can you talk about what CMS is doing to prepare for some of those shifts that may be coming along?
Absolutely. So just to start, over the pandemic, we've seen just how incredibly important health insurance coverage is. Every time we've needed to think about how do we give vaccines to people, how do we think about treatment, comes back to making sure that people have coverage. And so we're at record levels at CMS in terms of enrollment. Over 150 million people are enrolled across the 3 M's, as I like to say: Medicare, Medicaid, and CHIP, and marketplace coverage. And so keeping that coverage and making sure that people have access to care is an incredibly important thing for our country. We at CMS are very focused on trying to help states to understand the rules and really give them flexibility to take their time with enrolling people and re-enrolling them in Medicaid and CHIP in particular, because often people are in fact eligible for coverage. They just don't get their paperwork in time, et cetera. And so that is one area of incredible focus across the agency and the administration to help states have the supports they need to handle enrollments, but in a way that makes sure that people who are in fact eligible for coverage either stay in the program or transition to new coverage, whether it be marketplace coverage because their incomes have increased, employer-sponsored in coverage, or Medicare, of course. So that's a focus for all of us, and we encourage and are working with stakeholders across the nation to make sure that people know that they need to get their paperwork in when the public health emergency ends, and we're in that time.
Right. And I know that there's this kind of dovetailing where the pandemic really put a spotlight on health equity and, kind of the converse of that, health disparities. I know this has been a big focus of this administration and of yours. Can you talk about some of what you're doing in that area, especially as it relates to, kind of getting out of the pandemic?
Absolutely. I think is just as you said, we've seen the disparities. And I think that we have this critical moment where there's a different appreciation where we're using the language of really addressing disparities in health inequities in a way that we really didn't talk about before. And so I'm excited about that in the sense of it's an opportunity to make some real changes in our healthcare system. It's not going to be easy, but one of the ways that we are approaching it at CMS, and really we're hoping to be a model for the healthcare world, is by going systematically, and as we make every policy decision and every operational decision, really asking ourselves, are we asking the right questions? Are we thinking about how these decisions will affect people of all persuasions? So whether it's about race, whether it's about gender identity, sexual orientation, whether it's about where you live, and just the disparities we have across this nation in terms of rural and underserved areas and urban areas. We have a lot of work to do. And so we are really trying to be a model in looking across our programs. We have a lot of focus in particular areas: maternal health, mental health, on down the list where we know that there are disparities, and then really making sure that we are collecting data, particularly around not just the characteristics, but social needs, which often are a strong indicator of whether people are going to need additional services or additional perspective about whether it's cultural competency, et cetera. These are really things that we have to think about because one size does not fit all across our country.
Right. And I am looking through the list of topics I want to chat about, and it looks like a kind of a laundry list of the healthcare system's problems. But let's go to another one: nursing homes. That's been another area hit really hard by the pandemic. The Biden administration has made a push to, plug some of those holes and fix those problems. But the primary opposition we're hearing from the nursing home industry is that there's not enough staff and not enough money. So how do you kind of bridge these gaps between changes that are kind of obvious that need to be made, and some of the real obstacles in the way to making those changes?
Well, I would say that just as you said, this is a huge focus. It's a priority of the administration, and really, as you can see from the president himself, of really trying to make sure that we are focused on caring for our nation's elders and people with disabilities. And I don't know if there is a population more hard hit by the pandemic than nursing homes. And it's critical that we really address what's happening in terms of care. We are seeing a real rise in the complexity of the patients who are in nursing homes. And so I would say our approach is multifold. So we really want to work with industry and understand the pressures around staffing. Some of those issues, however, are really about making sure that people have career ladders and have the level of engagement that they need. We have high turnover in a lot of our poor performing nursing homes, so related. And I've spent a lot of time over the last year really engaging directly with workers, with nursing home residents, visiting nursing homes. And we've really tried to have a holistic approach. So one piece of it certainly is payment. And so one of the things we're looking at is, can we make sure that our payment policies are really reflecting the best practices? So we were a couple of months ago in the state of Illinois, a state that has made a huge push in terms of trying to make sure that their Medicaid payments really foster and encourage nursing home staffing, as well as other quality controls. We are engaging with stakeholders as we think about how do we approach a staffing requirement. And as you're seeing, we are releasing a lot more information around really trying to make sure we are emphasizing transparency, because some of the dynamics that we're seeing in the nursing home space really, we really want to make sure that owners are known to residents and families as they're making choices. We want to make sure that families know what staffing ratios look like, and that's why we are making sure and we are releasing more information as we look at our star ratings around, and really emphasizing again this staffing level, because we see how important it is to improving quality.
Right. In another area, it's not, this is more related to current events and of the summer and kind of in the post-Roe world. Maternal health and maternal mortality. These are huge issues in the US, and we don't land very well on the global scale of statistics in this area. Can you talk a little bit about what CMS is doing to improve maternal health?
This is such an area of focus, and the vice president, as you know, has really made it, really elevated it to a White House level priority, which has been really important. It's been really important for stakeholders. I've talked to numerous women who have been just so pleased that their stories are getting told and attention is being paid on this incredibly critical and painful issue. I would say, as we've released our maternal action plan, which is really focused on all of our areas where we're trying to move the needle. So first is coverage and making sure that people have access to care so that they're getting care even before they're pregnant. So we're so pleased that 19 states have taken up the American Rescue Plan flexibility to cover postpartum up to 12 months. So 12 months after the delivery of the baby or an adverse event, people have coverage, which is incredibly important because we know a lot of the deaths actually occur after women give birth. And so we're really excited that states are taking this important step. Secondly, I would say is just really focused on really making sure that where women are delivering is we're seeing improvements, and because so many of the deaths really are at the point of delivery. And so our birthing friendly designation is a first step in terms of really making sure that we are looking at what hospitals are doing, making sure they have maternal health collaboratives to try to improve care. And that is something that we really want to grow over the years in terms of the quality measures. And again, that's in our rules. We're introducing those now, but we want to continue to build on that in the coming years. And then third, really focusing on commitments from the industry, because we can't do this alone. So we, CMS, are putting measures on the table in terms of things we want to do in our programs, but we really want commitments from the industry across the board, because we know that where women are delivering babies, the coverage that they have, and again, like a lot of this starts pre getting pregnant, right? It's access to birth control, it's access to quality care beforehand, it's access to care while pregnant, so that symptoms aren't missed, so that that she has a trusted messenger to make sure that when she gets into the delivery room, that's a good experience.
Well, Administrator, there's so many other things we could talk about today, but we are out of time. Thank you so much for joining us.
Thank you for having me. Have a good rest of your day.
You too. Next, we have a view from the top with Chris Freites.
Good afternoon, I'm Chris Freites, and I want to thank our sponsor, CVS Health, for making this conversation possible. And joining me now from CVS Health is the Vice President of Pharmacy Practice Innovation and Advocacy, Sandra Leal. Sandra, welcome to Axios.
Hi, Chris. Thanks for having me.
So, of course, COVID-19 put this country into a public health emergency, and that really changed how we all get and access care. And I guess what I'm wondering is, post-pandemic, what do you see as the biggest challenges to accessing healthcare?
I think some of the biggest challenges to accessing healthcare is just accessing affordable and convenient healthcare for individuals. During the pandemic, we saw that this was exacerbated, and now people are trying to catch up. They're trying to catch up on their deferred care. And so that's a big issue that we're trying to deal with. The other issue that occurred is just the trust around the healthcare during the pandemic. So one of the areas that we've been focusing on is how important trust is, and pharmacies play a critical role in being able to do that. We know pharmacists are some of the most trusted healthcare providers, and people go there. People sometimes go there more than they see their primary care doctors. But we also know that pharmacists are underutilized with what they can be able to provide. So, as I'm thinking about some of the future opportunities, one of the things that we're looking at is how do we create a better experience for the patient so they're connected, so they can afford the care, so it's accessible to them. And then hopefully pharmacy can play a significant role in being able to address some of these pain points with our current system.
Yeah, and I think we've started to think a lot about that because of the pandemic. And I'm wondering, how has the pandemic changed the role of pharmacy in healthcare?
Well, it's incredible. I think that the pandemic has really highlighted the incredible role pharmacists and the staff have played during the pandemic. For the last 2+ years, we've had an incredible commitment, and our team has been phenomenal at being able to step into a very significant challenge. We saw that during the time of the pandemic, CVS Health provided over 50 million COVID tests, 67 million vaccines, and half of those were in underserved populations. And so we know that's still continuing to this day, so that hasn't gone away. In fact, one of the things that we're trying to do is really maintain the flexibilities of the pandemic that were afforded to the pharmacy staff so that we can continue this type of work post-pandemic. There's a bill in Congress, it's HR 7213, and what we're trying to do with that is make sure that pharmacists can continue this impact post-pandemic.
Yeah, I think we all saw that in particular with vaccines. I mean, many of us went to our local pharmacies to get those vaccines. And I think certainly we've also all seen the headlines about frontline workers and the challenges that COVID-19 has put on that workforce. And I wanted to ask you a little bit about that. How does CVS think about its pharmacy workforce? And what are you doing to ensure that pharmacy as a field continues to attract the best and the brightest?
So we've been very sensitive to that to help support them to be able to make sure that we're addressing the concerns that they have and be able to look at our operations to be able to effectively manage that. I know one of the things that I really appreciate and I'm very proud about our team is how they've impacted public health and how they really allowed for our populations in the United States to be served. Some of the sites that we served were underserved populations. Over half of the testing sites were underserved populations. And so as we're thinking about our continued contribution, we're not only looking at this now, but also looking at how the experiences that we've learned from the pandemic can actually contribute to future opportunities for the pharmacists. And so I'm thinking about areas around women's health access, management of chronic conditions, additional vaccination needs. And we know that a lot of population right now are currently needing those services because they haven't had the routine care that they've been used to over the last 2 years. So all of these things are things that we're helping to evaluate right now and to be able to support our staff to do that effectively.
And I wondered if you could just talk a little bit about what kinds of flexibility we've seen because of the public health emergency, and what are you trying to move forward with, right? If that public health emergency went away, what would we lose if we don't move forward with some legislation to make sure that that accessibility that we've built into the system over the pandemic remains?
Yeah, absolutely. I think some of the flexibilities afforded during the pandemic included, vaccinating children. There were some sporadic rules and regulations across different states, but now with a public health emergency, some of that has been increased so that the pharmacists have more ability to do that. There were also opportunities on testing where pharmacists could do testing and then treatment of individuals with the COVID pandemic. And we're not just looking at it from a COVID-19 issue, but what about the future? Some of these flexibilities can really allow for us to impact outcomes in healthcare in different conditions. So as we're thinking about other opportunities like care for women's health services or chronic disease management or other things like that, some of these flexibilities really build the foundation for us to be able to support primary care access for individuals, public health access for individuals, and those pandemic flexibilities are very important for us to be able to maintain that. Now, one of the things we know has to happen is that we have to be recognized as providers and then also reimbursed to be able to scale these services. And so we are seeing some traction in different states like Washington and Tennessee and Ohio. But what we'd like to see is more of a federal opportunity to have that recognition and help support these services long term. So not just during the pandemic, but continue so they can really set the framework for more access to care.
Yeah, and I want to follow up on that because we have just about a minute left here, but I want to end the conversation by looking forward as you previewed there. What do you think the future of pharmacy will look like?
Well, we're hoping that we've shown during the pandemic how incredibly important it is that the pharmacists are viewed as a very significant part of the public health infrastructure. So the goal there is to continue to leverage that experience and have, our policymakers understand the value that pharmacists bring to the table, how important we are for people's access to care. So we hope to be recognized and continue to expand on the services that I mentioned before around public health services, preventative services, primary care services. So I feel like it's a very transformational time, and what's happening with pharmacy was highlighted because this work was happening pre-pandemic, but post-pandemic, we hope that people remember how incredibly important the pharmacy community, the pharmacy staff was to maintaining health for the populations that we serve. So that's exciting. We want to make sure that people understand that and that they support us in being able to continue this type of work.
Sandra Leal is the Vice President of Pharmacy Practice, Innovation, and Advocacy at CVS Health. Sandra, thank you so much for joining Axios.
Thank you, Chris. Appreciate your time.
And now, your next segment.
Thanks, Chris. I'm Adriel Bettelheim, Senior Healthcare Editor at Axios. Our final guest is the representative from Michigan's 6th Congressional District, Congressman Fred Upton, joining us from Washington, D.C. Welcome.
It's a real pleasure to be with you again. Nice to see you. And I just want to say thanks for covering us like a blanket over the last good number of years, going back when I was chairman of the Energy and Commerce Committee, but you've been a health expert for a long, long time, and really looking forward to engaging with you on things that certainly are important to the whole country.
Well, thank you. You're very kind. And in your time on energy and commerce, you've shaped the way drugs and devices reach consumers and how the FDA works. You've worked on telehealth. You've worked on mental health reform. So as the country staggers out from this pandemic, what do you think is the biggest thing Congress should do in the time remaining this year to address healthcare access?
Well, that's a good question. We frankly don't have a lot of legislative time left. As we talk today, we're at the very end of July. Congress is expected to be out for all of August. Maybe we'll come back for one day, and September is really just a couple full legislative days. And then, of course, you've got the election and everybody watching what's going to happen. The House likely to flip. I think most experts say, who knows what happens in the Senate. We end up with a continuing resolution that punts everything into next year. So there's not a lot of legislative time left. Now, hopefully staying in response to your question, when I was chairman of Energy and Commerce, of course, our legacy issue, my legacy issue, the Congress's legacy issue, quite frankly, was the passage enactment of 21st Century Cures, which was the last bill that President Obama signed into law. There are a lot of really good things, but as we look back, it really set the stage for getting the COVID vaccine approved by the FDA, manufactured, and we actually do it in my district is where it goes out in the Portage, Michigan facility. But probably that vaccine was approved 8 to 10 months earlier than it otherwise would have been, which consequently saved more than, I don't know, hundreds of thousands of lives, certainly in this country and around the world. As we look to the future of what is likely to happen on healthcare now, the balance of the year, my partner in that, it was bipartisan. We actually passed it 53-0. Above me, I think you'll see one of these frames is a copy of the bill that every member signed. But Diana DeGette, a Democrat from Colorado, worked with me, a Republican from Michigan. We put that bill together. And in this Congress, we really put together what we call Cures 2.0. We put out a fairly decent document earlier this year. Took a lot of time to do because, quite frankly, with the Build Back Better plan and all the other, big spending bills that were out there, it was very hard to get the attention of the legislative staff. I'm not a lawyer. You got to have the legislative staff, lawyers write these things. It was a pretty comprehensive bill. And we looked at what could we do in the next step, remembering that to get cures passed, it was really a 3-year effort to get it done. And so we, again, listened to a lot of different disease groups out there. We talked to Francis Collins, then the head of the NIH, and others. We said, what are some of the lessons that we can learn from that? One of them was to make sure that the drug trials were more diverse. And that was a real, I'll call it a failure. It hurt us getting the vaccine into people of color because they were fearful of not enough was undertaken, I guess, in some of those drug trials. So particularly in minority communities, it was tough to get the word out. And I give real credit, at least in my district, to some great players who really reached out to those areas that were otherwise pretty high in terms of minority. Real world evidence. We want to use the real world evidence in terms of statistics to actually look at whether these drugs and devices are working. And we were able to get part of that already into the some of the PDUFA, the user fee agreements that's now at least passed the House, hasn't come through the Senate. We've got some other big issues that we'd like to see happen, the Pasteur Act, and this deals with microbial resistance. It takes tens of thousands of lives in this country. We want to get that done, and there's still work undergoing on that. It's bipartisan, but again, we don't have a lot of legislative days left. And I guess you could say that at the end of the day, we're probably looking at some of these big catch-all bills that we have to pass to keep the government open, just because the legislative schedule is sparse. It's hard to operate when I was chairman of the Energy and Commerce Committee, we had 2 or 3 hearings often a day because we had multiple committee rooms, and because of COVID, you're really restricted to just one committee room. So it's and with COVID too, we've got to have these Zoom markups and Zoom hearings, and you got people all across the country from California and Washington State to members. Frank Pallone, the new chairman, relatively new chairman, of course, is from New Jersey. So you can't really start a hearing at 9 o'clock because that's 6 o'clock in the morning someplace else. And you got, all these different time constraints that COVID really did impact the efficiency of the Congress as well. So bottom line, to answer the question, yep, there's still work to do. We're getting some things done. I'm working, talking to a number of senators in terms of different ideas that are out there. But clearly, at the end of the day, anything that happens has to be bipartisan. And of course, the closer you get to an election, and you've watched this for a lot of years, things are tough. Oh, you don't want to give so-and-so a win, but at the end of the day, I'm hoping that we can get some more of the elements done, attached to different bills, so that we can make progress on actually solving diseases that impacts, frankly, every family that's out there.
Well, you and the Congresswoman have worked in an unusually bipartisan and cooperative way. What will it take for members in Congress to find more of those collaborations again in the future? And will leadership even permit that in this climate?
Well, it's tough. The climate is tough, particularly as you look at, the likely change in the House in terms of flipping back. Most folks, I talked to, Charlie Cook and others, pretty good pundit out there. I think the margin is going to be pretty small. I think a little bit better margin of Republicans over Democrats. I'm in a group. I'm actually a vice chair of the Problem Solvers Caucus. This is a bipartisan group that's out there, over 60 members. And to get things done, when you have a small majority, better be looking to the other side to try and get some help. that happened recently now on the gay marriage proposal bill that passed in the House early July. 47 Republicans were able to vote for that bill, which is now prompting the Senate to get action. Diana DeGette and I have had a wonderful relationship. Leading Democrat, she actually chairs the Oversight Subcommittee today on the Energy and Commerce Committee. But we sat together, again, this was a multi-year effort when we did 21st Century Cures. And we said, how can we work together? We had a lot of meetings. We listened to people, listened to different groups that are out there, and we, in essence, packaged a very bipartisan bill through. We coupled it with $45 billion more in health research. And so we've seen some real successes. Sickle cell now is, we've identified how we can cure that. We've looked at a number of really positive things, advances in cancer, and exciting about Parkinson's and Alzheimer's, a good number of things that we moved. I would say that we moved the race years ahead to find a cure than otherwise we would have done it. But at the end of the day, if you don't work in a bipartisan basis, particularly, Biden's going to be president till 24. He's got to sign the bills into law. He was a key component when we actually did cures to get it done. He was a very active person. We needed every day, and it was again the very last day, literally the last bill that Obama signed into law back in December of 2016.
So help us understand, what's the Republican playbook on healthcare if the GOP flips one or both chambers? Safe to expect there will be oversight hearings of the administration, but what does the party really stand for heading into the presidential election cycle on healthcare?
Well, it seems like every election they say this will be the most important election of your life. And I think that they'll be saying that again about 2024. Obviously, we have to have a positive agenda. I would say that you're not going to see a repeal of Obamacare. That's in place, and so that's not going to be part of the package. But I would like to think that particularly my likely successor now as chairman of the Energy and Commerce Committee, of course, is today the top Republican, Kathy McMorris Rodgers from Washington State. She's been very involved in healthcare. She'll want to pick up the pieces along with Brett Guthrie, who's the current top Republican on the health subcommittee to move forward. So I'm excited that what we leave on the table, they can pick up and work again on a bipartisan basis.
Thank you, Congressman Fred Upton, for joining Axios. Thank you all for joining us this afternoon for another virtual conversation that's made everyone smarter, faster. For more information on the future of health access or to sign up for Axios' Vitals newsletter, visit axios.com/newsletters or find us on the Axios app. Thank you all for joining, and we'll see you on axios.com.